you or someone you love has just been diagnosed with mesothelioma, you're probably asking one critical question: which treatment will help me live the longest? It's the question every patient wants answered. And the honest truth is that the answer isn't the same for everyone. The treatment that helps one patient live 5 years might not be the best choice for another. But here's the good news. We now have real data showing which treatments are extending survival in ways that were impossible just a few years ago. And the answer might surprise you. It's not always about choosing one single treatment, but about matching the right treatment to your specific situation. Hi, I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. And today, I want to give you the most current, evidence-based answer to this crucial question: which mesothelioma treatment helps patients live the longest? Let's start by looking at what the data actually shows. The longest survival times we're seeing right now are in patients who fall into one of three categories: patients with specific genetic mutations who receive targeted therapy, patients who receive combination treatments rather than single therapies, and patients with early stage disease who are treated at specialized centers with multimodal approaches. First, let's talk about genetic mutations, because this is where we're seeing some of the most remarkable survival outcomes. Patients with germline BAP1 mutations, that's an inherited genetic change, have a median survival of 5 years. 5 years! Compare that to less than 1 year for patients without these mutations. This is a dramatic difference, and it shows us something critical. Understanding your genetic profile can completely change your prognosis. Here's what makes this even more important. Patients with those BAP1 mutations respond particularly well to platinum-based chemotherapy. If you have this mutation and you receive platinum-containing treatment, you're combining a favorable genetic profile, with the therapy that works best for your specific biology. This is personalized medicine at its most powerful. We're not guessing anymore about which treatment might work. We have data showing which treatment is most likely to extend your life. Now, you might be wondering, how do I know if I have a BAP1 mutation? That's where genetic testing comes in. The 2024 ASCO guidelines now recommend that all patients diagnosed with mesothelioma be offered germline genetic testing. Between 5 and 14% of mesothelioma patients carry pathogenic germline mutations, and BAP1 is the most common. Getting tested could reveal information that fundamentally changes your treatment strategy and your prognosis. The second factor in longest survival is the type of treatment approach. The Atomic Meso trial, which tested a drug called ADI-PEG-20 combined with chemotherapy, showed that patients who received this combination lived 4 times longer at the 3-year mark compared to patients who got chemotherapy alone. 4 times longer. This is one of the most significant survival improvements we've seen in mesothelioma treatment. How does ADI-PEG-20 work? It targets a specific vulnerability in mesothelioma cells. These cancer cells lack a protein called ASS1, which means they can't manufacture their own arginine, an amino acid they need to survive. ADI-PEG-20 depletes arginine from the bloodstream, effectively starving the cancer cells while leaving healthy cells unharmed. The elegance of this approach is that it's highly targeted. It exploits a weakness that's specific to mesothelioma. I need to be transparent with you. ADI-PEG-20 is not fully FDA approved yet. However, patients may be able to access it now through ongoing clinical trials or compassionate use programs, depending on trial enrollment status and FDA guidance. If this treatment interests you, Talk to your doctor about whether you might be eligible. I'm going to take a little break here to remind everyone. If you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get our videos seen by as many people as possible. And if there's a topic you'd like to see covered or a question you'd like answered in a future video, let me know in the comment section below. Also, make sure to watch until the end of this video, where I'll tell you exactly how to access help and resources if you or someone you love has been diagnosed with mesothelioma. Now, let me tell you about the other treatments that are showing the longest survival times. Beyond these breakthrough approaches, we need to talk about immunotherapy, because this is now a standard treatment that's extending survival for many mesothelioma patients. The Checkmate 743 trial showed that dual immunotherapy with ipilimumab and nivolumab, they're still hard to pronounce, Yervoy and Opdivo are the common names, produced a median overall survival of 18.1 months compared to 14.1 months with chemotherapy alone. That's an improvement of 4 months, which might not sound dramatic, but it's statistically significant and clinically meaningful. Here's where it gets interesting. The benefit of immunotherapy varies depending on your type of mesothelioma. For patients with non-epithelioid mesothelioma, which is one of the more aggressive forms, like sarcomatoid or biphasic mesothelioma, immunotherapy shows even greater benefit. This is huge because historically these subtypes have been much harder to treat and have had worse outcomes. Immunotherapy is finally giving these patients a treatment option that can extend their lives. There's also a newer combination approach, another tough one to pronounce, pembrolizumab plus chemotherapy. This combination was FDA approved in September 2024 and shows a 62% rate. What does that mean? It means that 62% of patients who receive this combination see their tumors shrink. Maybe more importantly, only 4% of patients experience immediate disease progression. This combination is particularly valuable for patients with symptomatic, high-burden disease who need rapid tumor control. So, with all these options, how do you choose? This is where personalized medicine comes in. The treatment that helps you live the longest depends on several factors: your histologic subtype, your genetic profile, your overall health, and any other medical conditions you have, the stage and extent of your disease, and your treatment goals and priorities. Let me give you some specific examples. If you have a BAP1 mutation, platinum-based chemotherapy should be strongly considered because the data shows you're likely to have exceptional outcomes. If you have non-epithelioid mesothelioma, dual immunotherapy might be your best bet because it works particularly well for those aggressive subtypes. If you have symptomatic disease with a high tumor burden and you need results fast, the pembrolizumab plus chemotherapy combination with its 62% response rate might be ideal. If you have kidney disease or conditions worsened by steroids, dual immunotherapy without chemotherapy might be safer for you than combination approaches. I also need to address surgery because patients often ask whether surgery will help them live longer. It's something that used to be done a lot, but the recent MARS-2 trial provided some sobering data. This large randomized trial compared patients who had surgery plus chemotherapy to patients who had chemotherapy alone. The patients who had surgery actually had a shorter median survival, 19.3 months versus 24.8 months for chemotherapy alone. Does that mean surgery never helps patients live longer? No, but it does mean we need to be much more selective about which patients are offered surgery. For highly selected patients with early-stage epithelioid mesothelioma who are evaluated by a multidisciplinary team at an experienced center with low complication rates, surgery as part of a multimodal approach can still play a role. The key is careful patient selection and treatment at specialized centers that have documented excellent outcomes. Here's the bottom line on longest survival. The patients who are living the longest are those who are receiving personalized treatment at specialized centers. They're getting genetic testing to identify mutations that might predict better outcomes. They're being offered the newest, most effective mesothelioma treatment combinations. They're being evaluated by multidisciplinary teams who can tailor treatment to their specific situation, and they're participating in clinical trials that give them access to cutting-edge therapies. So, which mesothelioma treatment helps patients live the longest? The honest answer is it depends on your specific situation. But here's what we know for certain. Patients with BAP1 mutations receiving platinum-based therapy can survive 5 years or longer. Patients receiving ADI-PEG20 plus chemotherapy are living 4 times longer at 3 years than those on chemotherapy alone. Patients receiving dual immunotherapy are seeing median survivals of over 18 months, with particularly strong benefits for non-epithelioid disease. And patients receiving pembrolizumab plus chemotherapy are achieving a 62% response rate. The key to longest survival is getting the right treatment for your specific situation, and that requires genetic testing, evaluation by mesothelioma specialists, and treatment at a center with experience in these newer approaches. If you or someone you love has been diagnosed with mesothelioma, visit mesothelioma.net and fill out our form for a free information packet with comprehensive medical and legal information. You can also call us at 1-800-692-8608 or use the live chat feature on the website to speak directly to one of our patient advocates who can help connect you with specialized treatment centers. As for me, remember, you can post any questions you have below. I'll see you next time.